More than half of 8,500 deaths in Iowa involved a person 80 years old or older.
Yeah, it's just what we don't want to hear. Older Iowans are the most susceptible to severe complications for the virus, and thousands of them living in long-term care centers are increasingly at risk. We want to show you some numbers tonight. First of all, let's take you back to January the 17th. Just 2 weeks ago, we're talking about 56 outbreaks at long-term care centers here in the state of Iowa. By the next week, we were setting some disappointing records. You can see the trend that takes us all the way down here to January 24th, where we hit a new high with 76 outbreaks. These records continued to fall as the numbers went up. Tonight, we're at 107 over here, nearly double the number from just 2 weeks ago. We have WHO 13's Kaylin Thompson joining us tonight. You talked with one of the facilities that is struggling with this virus.
Yeah, Dan, they tell me that they're keeping up with COVID protocols like masking and testing, and the majority of staff and residents are vaccinated. But some families are concerned not enough is being done.
It's another place healthcare heroes go to work, but the numbers show nursing homes are not immune to COVID-19.
The virus that we're seeing today is very different than the virus we saw a year and a half ago. Less severe, but more contagious.
Trinity Center at Luther Park Community is one of the more than 100 long-term care facilities that are reporting outbreaks. CEO John Ricci says in mid-January, several residents at the 120-bed facility tested positive. While their safety is the priority, he also has to think about the people who take care of them.
Whereas our residents were able to remain isolated in their rooms and be able to quarantine there, our staff could not work if they tested positive.
The state health department designates an outbreak when at least 3 residents test positive within 14 days. Once a facility goes on outbreak status, positive staff members are also included in the count. And across the state, those numbers are higher.
Well, the first week of January, we got data on the number of cases we were seeing, and about 205 of those were resident cases. 796 were staff members. So it just directly shows that we are concerned about the impact on staffing this is having.
As nursing homes keep up with protocols, some families of residents are still worried. One viewer writes to me, the homes need to have restrictions to protect our loved ones from outside visitors who may unknowingly have it. I don't think enough is being done. But those in charge of them maintain,
while the numbers are high and our population that we're serving is very vulnerable because of their age and thus we take it very seriously, there is really no safer place for a person to live or to work than in our own environment because of the precautions that everybody takes every day.
I'm told positive tests are decreasing at Luther Park, but it will take 28 days after the last positive case is detected in a resident for an outbreak in a long-term facility to be considered resolved. So that's a pretty long timeline.
Yeah, a long time for people to wait if they've got a loved one sitting in there. Thank you for those numbers, Kelly.